Friend, I think it's time for us to say we have been deceived enough in this side of the world. We are buried enough. We buried breadwinners, buried loved ones on things that are not just only curable but preventable. What do they call this in your own language? This is the reason a lot of our loved ones have been buried. Many have been amputated, which as it stands today, by reason of what could be done on chronic ulcers, majority of those amputations are not necessary. My friend, please join this campaign. Just last week, I got a very heartbreaking news of the mother of a family friend. I just got to know that she happened to be a non-diabetic and incidentally got a wound ulcer on the leg, and they say it is a poison, and took her to somewhere where they were using something to be covering her, and some say the attack from their uncle. And you know what? By the time they presented this lady to the hospital, that leg had decayed. They did amputation. The woman never survived. And my heart wrecked. These are the things that I can tell you today. That amputation was not necessary. All this wound you are seeing today can be cured. Can be cured. And I will explain to you why those things are there. And when you see anyone who wants to talk nonsense, that you know that this wound I had is because of the poison I mashed, is ochele, and all manner of stuff they may have told you, tell them that what you are passing through is what Dr. Richard Okoye showed us, as I will do today, that this can be healed. Now listen to this. Any person you see that has leg ulcer, wound on the leg, or one leg is getting swollen bigger than the other, or you're having this kind of varicose vein, listen to me, there's no mystery behind that. I will tell you, any person that has a wound ulcer may come from any of this. It could be from a diabetic ulcer. Any person with diabetes stands the chance of, number one, having a wound ulcer, and that wound ulcer may not be healed. Any person also that has what is called venous ulcer, also that ulcer may not heal. Or what they call arterial ulcer, ulcer that resolves because of the blockage of the arteries, that particular wound may not be healed. Apart from the pain and other associated things, if that leg is allowed to be, that particular leg can go this down and can dry up. And if it comes to this level, I can tell you, they will tell amputation. But you know what happened? These legs can be rescued. These wounds can be healed 100%. Fundamentally is to know the origin. What is the cause? Or can it even be a skin cancer? Most painful aspect of this is that most of our people are dying on ignorance. Most times they will now say, tie the legs with bandage, wear tie stockings. My friend, it is not in all cases of ulcer that you apply pressure stocking. If it happen to be an arterial wound ulcer, you condemn that leg with what you are tying. That's why it is important that the root cause of that particular wound is first of all identified. Now, let me tell you something. We are buried enough. That's why my heart is out to make you understand that this very wound can be healed. Now, I would like to talk this for at least health workers also to understand how we can save a person from amputation, which unfortunately has been the order of the day here. When someone presents with wound ulcer, a wound that is chronic, is not healing, the first thing you have to do, you need to first of all check out the peripheral pulse. If you look at that very pulse, arteries normally do boom, boom, boom when you feel it. If you are a man, you will feel it boom, boom. If that very pulse is full, it's suggestive that this person is suffering from venous ulcer. But if that very pulse is staying or no pulse there, my friend, if you tie that very leg, that leg is gone. Amputation you are heading to. And that is the first thing to do. And also, to identify where this thing is coming from, doing an ultrasound Doppler or what is called CT angiogram, we trace where this very vessel is coming from. Do you know the good news? With a vascular surgeon intervention today, most of those arterial blockage can be healed. That particular blood vessel can be recannulated and blood will start flowing. And once blood gets into a wound site, the wound can be healed. It's not antibiotics that heal wound. Wound will heal naturally as long as blood is coming to that place, bringing what it will take to heal it. And that's exactly what is required. That if you have a mom or a dad or someone with diabetic foot ulcer, mind you, that person is heading towards amputation. If what I'm talking right now is not assessed and attention be given to it as quickly as possible. Even in the case of varicose vein is no longer an issue today. With a simple laser procedure, you can seal up all those veins and the person's leg can come back to normal. You know what? In this side of the world, we usually put attention to other things, but our health is not valid. Somebody will say, oh, you know, the thing is expensive. No, healthcare is expensive. Let us accept the fact that our problem is because there is no money, so that we can seek for favor. Instead of saying that it is an attack and demons and prophecies and all kind of a thing, that's what we are living with and burying our people. But if you think that to attend to that case, no, it's expensive, you know what? Imagine on your head when they cut off your legs. And at adult age, you start learning how to be in position to jump. It is important that we give this in attention. Good news today, majority of the wounds you see on people's leg can be perfectly healed. Our people have to live, and we must live by the power of knowledge. Please, can you share this knowledge to everyone you know? Keep sharing it. You can see someone just somewhere right now being tormented, and even a wound that is already there about to kill this person, somebody is packing some nonsense again on that same wound to pack all manner of bacteria into that wound to kill the person faster. We can do better by sharing this. Someone's life is at stake. Why not be a Messiah to them? God bless you.